right, so everybody, thank you so much for joining us for this afternoon's Doctors In program, and thank you as well for bearing with us as we get started here. For any of you who are new to Doctors In programming, this is a series that we do between the Elder Initiative at the William Wade Community Center and Jefferson Health. We've been doing this for a little over 3 years now, the last year and a half of which have been in virtual form. But really having a monthly health presentation on different health topics related to aging within the LGBT community and some of the health issues that folks should be aware of. This is specifically a partnership with the Jefferson Department of Family and Community Medicine, which houses the Division of Geriatrics, and also the Jefferson Center for Health, which is involved in a lot of the community health programming run through Jefferson. For any of you who are new to Doctors In, and particularly our Zoom programming, throughout the program, totally welcome you asking questions, either through the chat feature or through the Q&A, both of which you should be able to find in the toolbar at the bottom of the screen. Do know that anything you say in the chat does have your name attached to it. If you are submitting things through the Q&A, there is an option to do so anonymously to check that you don't want your name attached. So if you were asking anything more personal that you want only to go to us as the presenters without your name, do use the Q&A feature. I think it's fine, Dr. Emma, if you're okay with it, for people to kind of ask questions throughout or share anything in the chat. I'll keep an eye on the chat so that you don't have to, Dr. Emma, as you're presenting. But we can kind of take questions as they come, and we'll also save some time at the end for folks to ask their questions. Today's presenter, Dr. Emma Delau, thank you so much for being with us. Glad to have you back at Doctors In programming. I will turn it over to you to get us started with the presentation.
Thank you. Yeah, I'm really excited to be here again. I'm going to be talking about caregiving, a pretty important topic. And I'm just gonna dive right in. So I'll go over some definitions. We'll talk about statistics, mostly numbers from a national survey amongst caregivers. And then I'll touch on caregiving in the LGBTQ community specifically. And then the majority of the talk I'm going to spend on the impact of caregiving, and we'll talk about tips, kind of more practical tips for caregivers, and I'm going to share some resources. So the definition. So what is caregiving? So caregiving is the act of providing physical, psychological, emotional, and or instrumental care to another person. And typically that's being done for a longer period of time, can be a few hours a day or a few hours a week, but even up to 24 hours a day, someone can need caregiving. For example, in someone with dementia, that's pretty advanced. People may need 24-hour caregiving. And a caregiver is the person who is providing any type of care informally and without financial compensation. And really, it's the caregivers that are able to make what we call aging in place. So people preferring to age at home and in their community rather than going to a long-term care facility. It's really the caregivers that are able to make that aging in place possible. Important to highlight, I think, is that people who provide care, especially the informal type of care, may not always think of themselves as a caregiver. And also older adults who are receiving care may not identify themselves as being care recipients, and even maybe providing care to another person themselves at the same time. What kind of things do people need help with? So that can be a whole lot of different things. Medical terms we use is activities of daily living and instrumental activities of daily living. So activities of daily living are kind of like the basic life needs, like bathing, dressing, going to the bathroom, moving from chair to bed, back to the chair, and incontinence stuff, and feeding. And then there's things that are the instrumental activities of daily living are more so the things that are needed. If you're able to do those yourself, you're able to live independently, basically. So that's keeping track of finances, grocery shopping, other type of shopping, cooking, doing stuff around the house like cleaning and laundry, transportation, getting around, and keeping track of medications and taking the medications. And then other activities that caregivers can do include keeping track of someone's health condition and going to doctor's appointments, and really advocating for that person with professionals, or with providers or with services or agencies. So it can be a whole lot of different things. Who are caregivers? Anyone can be a caregiver. And anyone can be in need of care, obviously. Most commonly, we see that it's relatives. So parents, children, spouses or partners. But it can very well also be non-relatives, meaning friends, peers, neighbors, or really anyone. So some statistics, and like I said, this is coming from a national survey among caregivers, and the AARP and the National Alliance for Caregiving every 5 years do a really large survey so that it kind of represents the US population. And in 2020, there was just the most recent one came out, and it's estimated that 53 million Americans are caregivers. So that's 1 in 5 people. And the majority of people take care of people over the age of 50. So that's almost 42 million. And those numbers are rising really because our population is getting older. And what we also see is that most caregivers take care of one person, but the number of people taking care of more than one person is also rising. So that makes caregiving just even more complicated when someone has to take care of multiple people at the same time. Some numbers on demographics. So it's kind of a stereotype that women are caregivers, but we're definitely, a lot of men are also caregivers. 8% self-identify as LGBTQ. The average age here on the right is in the graph is a little over 49 years old, and over half of the people is over the age of 50. And then 61% white, 17% Hispanic, 14% Black, 5% Asian American. So it kind of represents the US population. As far as the age of the people receiving care, most care recipients are over the age of 50, with about half, what you can see here all the way on the right, the tallest column, is over the age of 75, with the average age close to 70. Where do people who are getting care, where do they live? So most people live in their own home, but a lot of people also live in the household of the people of the person taking care of them. And what this graph shows is the red columns are the data from 2020. The gray ones are from 2015. And so what this shows is that in 2020, it seems like there's more people now living in their caregiver's household compared to before, which I thought was interesting. And then what kind of problems do people receive care for? So most people who require care have a chronic condition that they need care for. And about 1/3 of people requiring care have more of a short-term physical condition, like they just had a pretty bad disease for which they had to be in the hospital, or they had surgery, or they had an accident, and now they need care for a little bit of time to just really recover from that. And then there's mental health issues, and memory problems are two other big reasons for people to require care. This graph is from that same survey, and shows the responses of caregivers when they were asked what the main reason was why someone needed their care. And the most reported answer was old age, and then mobility issues, so people having trouble getting around, is a big one too. Alzheimer's disease or dementia. A lot of people require care for that. And then there's surgery or wounds, cancer, mental or emotional illness, and then other chronic conditions, back problems, stroke, diabetes, heart disease, and breathing issues, blindness as well, and arthritis at the bottom. So a whole lot of different reasons. This graph shows the kind of activities that caregivers help out with, kind of what I mentioned in the beginning. So I wanted to put this in here just to kind of show that 6 in 10 caregivers help out with any of these kind of basic life needs, with the most commonly helping out with getting in and out of the bed and the chair. And then also fairly common helping with getting dressed, helping with bathing or showering, and helping with feeding. And this is for the instrumental daily activities of daily living. So almost all caregivers help out with any of these, 99%. And the majority will help out with 2 or more of these, with the biggest things, transportation, going to the grocery store, other type of shopping, work around the house. And then it kind of goes down, but prepping meals, helping with finances, giving medications, and helping with outside medical services. So that was interesting that, you know, if you're thinking of caregiving, this is probably the first things that people need help with. And so I think having a choice to take on care is an important aspect of caregiving, really because it's been shown that when people feel like they didn't have a choice, they more often are in more complex care situation and more often have more stress. And this graph shows how a little over half of the people feel like they didn't have a choice in taking on that role. It's almost 50-50, but a little more than half did not have a choice. So I just wanted to highlight a few things I think that were interesting, specifically on caregiving in the LGBT community.
Emma, if I could jump in before you move on to this next section. I'm just curious, so for folks who feel like is there research to suggest that like the health outcomes of the caregiver are different in those situations? Like folks who get put into caregiving roles feeling they don't have a choice, are those caregivers more likely to experience either greater stress or emotional fatigue? Is there any research to suggest some difference in those?
Yeah, and I don't have the research articles, readily available here, but yeah, I think the not having the choice often means that there was some big accident or something big with the person you're taking care of that made it kind of a forced, this person really needs your help and there was no other option. So the fact that the other person that you're taking care of may be sicker or it was more acute and we didn't see it coming, that on its own already causes more stress. Right. But I think also the feeling of this wasn't my decision. The less, and we'll talk about that a little bit when we're talking about caregiver burnout. But the not having that choice or a say in things can really increase stress. Yeah.
Yeah. Great. Thanks.
Yeah. That's a great question. Are there other questions in the chat while we're?
None so far, but definitely encourage folks, again, to feel free to share things in the chat or the Q&A feature.
Yeah, feel free to interrupt. So LGBT caregivers make up about 9% of all American caregivers. So it's about 3 million people in the US. Actually, it's relatively more common to become a caregiver. About 1 in 5 LGBT people become caregivers as compared to 1 in 6 in non-LGBT people. And what we've seen is that LGBT older adults are more likely to care for another in isolation, kind of meaning that they're not the primary caretaker and not having many other people help out in the care. And so not able to share that burden that comes with caregiving as much. And then also more commonly rely on close friends of similar age, which as we get older could mean that at some point the caregiver develops some illness themselves and is not able to continue taking care for a longer time. So those two things really kind of highlight the importance of trying to create a network of other people taking care of the person who requires care to really avoid the increased stress that caregivers can experience. And then lastly, many fall also in multiple categories of caregiving, meaning that at the same time they could be taking care of multiple different people, which also can increase the stress. So that being said, let's talk about the impact. So first of all, caregiving is pretty expensive. The annual costs of caregiving is estimated to be $522 billion per year. And so pretty big burden. And if that cost were to be replaced with all professional services, it would be even higher, as high as over $800 billion. It has a financial impact. Not only is it very expensive, but also almost half of caregivers have had to experience some financial impact. And this graph on the right kind of shows the kinds of impact. So either having to stop saving, taking on more debt, using up personal savings, not being able to pay the bills or pay them late, or having to borrow money from friends. And caregiving to a spouse or partner, those caregivers are experiencing higher levels of financial strain compared to caring for parents. And LGBTQ caregivers often report high financial strain as well. Also some impact on work. So 2/3 of caregivers is employed and about 2/3 of them works full-time, 60%. And caregivers don't always feel comfortable to tell their supervisor about their caregiving role. And at the same time, balancing work and caregiving can be very difficult. And so 6 in 10 caregivers experience at least one change they had to do at their job to be able to do their caregiver role or had to. And so the most common thing that people have had to adjust at their work was either going in late or leaving work early or having to take time off. But also things like taking a leave of absence or turning down a promotion, retiring early, or even stopping your job altogether.
Dr. Emma, we did have a question come into the chat, going back to that last slide on LGBT caregiving. The question really being kind of what are some of the reasons that we think LGBT people are more likely to become caregivers than non-LGBT, heterosexual, cisgender folks? Part of the question being, is this kind of because of the isolation that many of in our community experience, or are there some other factors that might be at play there?
Yeah, that's a really good question. And I don't know if there's a clear-cut answer to that. I do think that maybe the isolation, I think another thing may be that some people may feel more uncomfortable going to the doctor or asking for other services, and that potentially would rather keep the care close from a close friend, for example. Yeah, I'm not sure on the exact statistics.
Yeah, I think that's an important point, though, knowing that
Yeah.
that many folks are going to be maybe have some valid hesitancy about reaching out to a home care agency and would rather have a friend or others in the LGBT community help with some of that caregiving. But yes, I think it's interesting. I think there also might be a piece too that I've just heard anecdotally before, especially in terms of, for folks who still have parents who are living and have relationships with them, that, sometimes it's the LGBT family member who gets thrust into those caregiving roles, especially if their siblings have children or grandchildren and they themselves don't.
Yeah. Yeah, and then at the same time, that's exactly what I meant with the multiple. It could be that there's multiple caregiving situations for the family of choice and for family that maybe you're not that close with, but they view someone as being more available because there may be no kids, or so it's a very, very good question.
Thanks.
Yeah, it's and also I think in general these numbers are hard to really study, just because a lot of people, like I said earlier, may not even realize they're taking care of other people. So whether the numbers are entirely accurate, that's also, a little bit questionable. Yeah, any other questions?
That was it. That's in there right now, but I'll continue getting questions in, folks.
Sounds good. Yeah. So caregiver experience. So most people do experience caregiving as very meaningful and important, but it can definitely be also a very challenging role. And some positive things that I've heard and read about is the feeling of forming a very close bond with the care recipient, and having that feeling of satisfaction from being able to give back. But it's not uncommon for caregivers to feel stressed and overwhelmed as well. And those feelings can be, can go together too. It's common to feel alone, and even feelings like anger, frustration, either towards the other person you're taking care of about their health or their condition worsening, or the feeling that you're trying to do a lot of things, but it may not be recognized as much by the care recipient. And at the same time, your own life and your own family and friends, you may not have enough time or as much time that you would like to spend with them or doing fun things. And that can also cause feelings of guilt, feeling like you're not enough there for the person needing care, but at the same time, not enough there for yourself or for your loved ones, who you may not be able to spend as much time with because you're caregiving. And just kind of looking at the well-being of caregivers, almost a quarter of Americans who are caregiving say that the caregiving has made their health worse. And what you can see on the right here is that the majority rates their health as very good or good, but that 1 in 5 actually rates their health as fair or poor. And it is common for caregivers to kind of neglect their own health because they're so busy caring for another person or even multiple people. And so we see people having to skip doctor's appointments, giving up time with their friends, not having time to exercise or sleep or have time for relaxation. And so that can really affect someone's health and how they're perceiving their health. And again, people don't always realize that they're caregivers. And I think that's important to highlight because there's a lot of support and a lot of resources out there, but if you're not aware that you're a caregiver, you may not feel like you can use them, or that you should use them, or that it's even something that would help you. And you may be unaware of the large amount of people around you who are also caregivers and who could potentially be of a support or share experiences with. And I'm sure we have a lot of people in the audience today who may be a caregiver, maybe receiving care, maybe both, but potentially may not realize it yet. So I'm hoping that with this talk, maybe we can kind of become more aware. So a little bit about caregiver burden. So that is really caregiver burden, caregiver stress, both used. It's really the stress that comes with caregiving, including physical, social, psychological, emotional, and financial strain that is associated with caring for someone over a long period of time. So people could feel depressed, withdrawn, have a poor diet or poor appetite, feeling exhausted, or experiencing health problems, getting sick quicker. And this can really have a negative impact, obviously, on the caregiver, but also on the care recipient, that when the caregiver is not feeling 100%, it's really hard to give the optimal care to the other person. And if this persists long enough, it could lead to caregiver burnout. And that's really when the condition of feeling exhausted, not having energy, and not being able to cope. So it's fairly similar, but this is just more severe, I would say, after the stress has been persistent for a long time. And this could really lead to not providing the best care possible. So potentially making mistakes, maybe forgetting to give certain medications. The person you're taking care of may need to, earlier than anticipated, need to move to a long-term care facility. But it could also lead to unhealthy behaviors within the caregiver, like alcohol use, drug use. Really hard to point to one clear cause, but it's kind of a combination of multiple potential factors. So like conflicting demands, meaning that you have to do too many different things that are asking too much of you. So too much, maybe the combination of work with being at home with your loved one, and having too many different things maybe you need to do for the care recipient. Unreasonable demands, maybe doing too many things that you don't feel comfortable with, or too many. The lack of control, that kind of goes back to that not having the decision in becoming a caregiver. Lack of privacy, you may not have time to, go home, do your own thing as much as you need. And unrealistic expectations could be from, for example, taking care of someone with dementia who may not be able to show how much they appreciate your care. And that can be really hard. And when someone is caregiving in isolation, meaning without that network of support of other people or agencies helping out, that can increase the risk of burnout. So I want to touch on respite care because I think that's a really important kind of break that's available when needed, but it's underused, I think, or maybe not known enough. And I know last month, I think Liz talked a little bit about this too, but really it's meant to give caregivers a break from caregiving. And so the person who needs the care can be in a safe, qualified setting, still getting the care they need, but the caregiver gets some rest to really, recover from their stress. And this can be really helpful, really, as you're functioning as a caregiver. So it could feel, I think, for some people maybe as a failure that they're not able to do the caregiving, but really it's important to take that break that you may need, really to be able to become a better caregiver and to be able to really provide the best care, and to take care of yourself, obviously. So we're going to spend a lot of time talking about how to take care of ourselves. There's different settings respite care can be given in. So it can be at home when there's a friend or a volunteer or even a paid service coming to help out, so that you can have a few hours or days of a break. There's adult daycare to give, the hours during the day to free those up for the caregiver. And then there's long-term care community where the person could go for as long as needed, basically, as well. So before moving on to the more practical tips, I wanted to kind of see what are the things that caregivers feel like they need more training in or more knowledge about. And really the bigger things are keeping the care recipient safe at home, managing emotional and physical stress, managing paperwork, and what kind of activities can you do with the care recipient. And then there's also more difficult, like making end-of-life decisions, how to handle finances, how to figure out home care agencies or nursing home. So these are some things that people tend to need, help with or more information about. So we're going to touch on a few of those with the tips. So really how to stay engaged, healthy, supported as a caregiver. I found this through SAGE and the ARP, this planning guide for caregivers in the LGBTQ community. I have it in the resources at the end, but I really liked how they kind of made an easy guide as to how to start caregiving. So starting with a conversation, meaning that before you start being a caregiver or before you need care, to have a conversation with the people around you about your values, what's important to you, what kind of things would you want and would you not want. And this is the same for if you need help, but also if you're being asked to be a caregiver potentially. Then make a plan. So put together kind of the kind of things you'd want. This also includes if your partner or the person you want as your primary caregiver, if that's not a legal spouse or next of kin, to have that documented in a formal place, so that when someone needs care in the hospital, that the doctors know that you're the one to turn to, and that you're able to make those decisions for that person too. Form a team. So caregiving will be more effective when you're in a team. Will be less stressful too. So trying to find a network for people around the person who needs care, and then find support. So that can be with friends, with people around you, but also with support. There's a lot of support groups and a lot of disease specific, like the Alzheimer's Association has support groups for people with Alzheimer's and their caregivers as well. And that's for a lot of diseases. And then caring for yourself, which we'll talk about more, but really keeping in mind what's important to you, what are your needs, and how you're able to still get what you need as well. So this is 10 signs of caregiver stress that I found on the Alzheimer's Association website. Things like denial, anger, social withdrawal, not wanting to go outside or seeing other people, feelings like anxiety, depression, feeling exhausted, sleeplessness, which is a common one as you're worrying about all the things you need to do, worry about the person you're taking care of, potentially, maybe their health is declining, irritability, lack of concentration, which can be a big one if you're having trouble concentrating, That could lead to errors with medications, for example, and then health problems. So feeling sick, becoming sick more easily. And really, if you're experiencing any of these for a longer period of time, is a reason to go to the doctor and talk about what you're going through and what you're experiencing. This is a little bit more of the same, but a different infographic that I liked on caregiver burnout. So on the top, it's showing the signs and symptoms. Again, kind of mood swings, low appetite, weight loss or weight gain, being more irritable, not interested in social activities, feeling hopelessness or guilt, fear, and really when you're starting to see changes in eating, sleeping patterns, problems with relationships or problems relaxing, that's concerning that you could have a caregiver burnout. And here's 8 points on how to prevent caregiver burnout. So the number one is recognizing the signs of stress and exhaustion. So I think that's what, we're doing now, making sure that we're able to recognize it. Scheduling time for yourself at a regular basis. So as much as, every day, trying to make sure that there's some time to yourself. Maintaining good health habits, which I think is easier said than done, but making sure you have a healthy diet, sleep enough, exercise. And then number 4 is remain socially connected. So able to see friends or a person you trust to be able to talk to what you're going through. Join a caregiver support group, I think is a good one. And then speaking to a therapist could be really helpful, and seeking that respite care we talked about for the person you're caring of, really to give yourself a break. This isn't, how are we doing on time? I think for this, this is important, but it's kind of rehashing the same thing. So important to ask for help, join a caregiver support group, important that time for yourself. So taking breaks, spending time with friends, trying to keep up with your hobbies and interests, which as I'm saying this, I'm realizing this is very easy for me to say right now and really hard to do when you're busy being a caregiver. Eating healthy foods, being able to exercise as often as possible, and then important to also see your own doctor at a regular basis, and trying to keep your health and finances and stuff up to date. So I found this self-care for the caregiver webinar through Sage, and I have the link at the end of this presentation too. I would really recommend people watching that if they, basically anyone could use it. But I learned a lot from it, and I try to kind of summarize what I learned. So really important to be paying attention to your needs and making the space to address those needs. And obviously that can look very different for everyone. But the most important parts are being kind to yourself, so self-compassion, and being present in the moment while you're doing this. And then really the focus is on kind of slowing down, taking a step back, and realizing to then be able to get what is it that you need. Really, because, you have to come first before you're able to take care of someone. So this self-care, really, how does that look like? How does it look, or how do you get what you need, basically? And the first step is to identify things that make you happy. Setting boundaries, so trying to say no more easily. So for example, if the person you're taking care of wants you to look over bills, you could say maybe something about, I hear that you need help with your bills, but I'm realizing I haven't eaten in 5 hours. So I'm going to go out, get lunch, and then I'm going to take some time and walk around and get some air. And when I come back, then I can help you look over those bills. And that's difficult to do, but that's why we need to practice. Identifying triggers. So there's for everyone, I think there's moments throughout the day where they're more easily stressed. So like whether it's getting up in the morning, rushing to work, or making dinner. But if there's a moment that makes you more easily stressed, or where you notice that's my trigger, that can be a starting point to ask for help for those times. Cultivate support. So again, friends, people you trust, or formal support groups, and then treating yourself as well. They gave an example of someone who really likes coffee. Even if it's just smelling the coffee beans for, 10 seconds in the morning, can really help make you feel a little less stressed. So there's different types of self-care, obviously, but it can be very practical. If you have a to-do list and you need to do laundry or make it to a doctor's appointment, or even making a doctor's appointment, would be a form of self-care. It could be physical, like exercise, but also like getting a massage, or getting a nice meal that's healthy. It could be spiritual, which really could make people feel more positive or more connected. So whether that's practicing a formal religion, or meditating, or journaling. Could be political, emotional, and technological even. There's a lot of apps that can help meditate, or even the reducing screen time may be self-care for you. And so I wanted to just take a second for everyone to kind of think about what is it that makes you happy? What kind of self-care of the kinds that we went through would fit you best? And then what kind of boundaries could you maybe think of to set to make more time for yourself? And if people want to share, that's fine. Maybe people can learn from that. But if you don't feel like sharing, that's totally fine too. And I'll just maybe see if we can take a minute or so.
I'll just say too, as folks are thinking or reflecting on that, I think tying into what you were talking about earlier with respite care, that sometimes utilizing some of these respite services or an adult day center, that then builds some time in your day to practice some of this self-care.
Yeah, that definitely is self-care. Yes.
Yeah. I think it's okay if folks just reflect on this if people aren't comfortable sharing publicly, but these are obviously important questions to think about.
Yeah, I'll move on, but if you see things pop up, just feel free
to writing poetry and watching Netflix.
Yes, I'm all for Netflix. Yes, that's a very good. Yeah.
Great.
Alrighty. So this is just kind of an example of how journaling could look like, really to kind of figure out for the person writing this, how did you end up in this role? What is your role? I'll just go through it real quick. So you could start, this is just a template idea, but you could start with an introduction, kind of focusing on the time and place of how the caregiving began. Really to reflect on, the experience and how you got in that role in the first place. And then my caregiving would be your reflections on the caregiving so far and the relationship with the person you're taking care of. And then my care for myself would be kind of reflecting on how you're caring for yourself as a caregiver and as a person, really to kind of highlight what are you already doing, but also what are the things that you need or may need support with. And then my practices and self-care habits is kind of the things we just talked about. So reflecting on what kind of things are you doing already and what things could you maybe do more or would you like to do more of. These tips are coming from the NIH and the National Institute on Aging, which I like. So this is for caregivers who would go with their the person they're taking care of to their doctor. And so one good tip is to discuss beforehand what kind of questions or concerns the person you're taking care of have, and to bring a list with those questions. And then during the visit, take notes of what's being said and what's being discussed. Also really helpful is to bring a list of all medications, including dietary supplements, really to, make it easier to discuss that with the doctor, but also to make it for the doctor clear what is prescribed, whether that's actually being taken or if there's any issues with the medicines. And then this sounds kind of obvious, but let the person you take care of talk directly to the doctor. So if the doctor asks questions, it's important to let the doctor's patient, so the person you take care of, talk to the doctor, and then respect privacy. So you could, it could happen that you're asked to leave the room, which is totally appropriate. And then ask for community resources. And if the doctor or whoever is taking care of the person doesn't know, it's also really helpful to talk to a social worker if they're available, who will probably have a lot of valuable suggestions about community resources.
Are you okay with a couple questions right now, or would you rather, do you want to hold things until you're done with this section?
I have a few resources after this slide, and then we can do questions because I know we're almost out of time. So I'll go through this quickly, and if these slides are up, then you can refer back to maybe the resources too. But I put some things together on how to find in-home services so that you're not all doing it by yourself. And I like the Elder Care Locator has a phone number and a website too. And then the disease-specific associations often have a lot of in-home service resources. This one, I wanted to make sure we have time to let folks know. So there's a lot of free websites and apps that make it easy for a whole, they call it care village, to kind of come together online. So it's an easy way to invite people, or people can join. It's an easy way to share medical updates or other kinds of updates with everyone who's involved in the care. But also an easy way for other people to sign up for certain tasks. So if someone needs to go to the doctor, but you're busy doing that, it's easy for others to kind of come together online. And so these websites have those calendars, and the Caring Village also has a really nice app, and has like free resources with a checklist to bring to the doctor. They have like a list to how to write down all the medicines. Elder Care, Caregiver Corner answers a lot of commonly asked questions from caregivers, including things like transportation, or what about Medicare, or I don't understand. A lot of different questions are answered. This is that webinar that I was talking about that I would highly recommend to everyone. These are some other places. National Institute for the Aging has a lot of caregiving specific information and resources as well. And then SAGE, this is that guide that I was talking about, that I have the PDF link here. That is, I really like the way they went through it step by step. And then I didn't want to miss out on, if someone here needs a caregiver, here is a hotline phone number to get help with caregiving. And then, this is basically everything we talked about. Caregivers, there's many caregivers. Caregiving is really common, really important. The need for caregivers is rising. It can be a big impact, both positive, but also negative, with feelings of anxiety or a lot of stress. Caregiver burden is real, but know that you're not alone, and that taking care of yourself is really important. And I think the biggest thing is, don't hesitate to ask for help, because it's things caregiving, you can't do all by yourself. So with that, yes.
Thank you. Yeah, and we do have some activity in the chat, so I'll share some of these with you. One, just a comment, but that I think is really important to name and to just identify the fact that, obviously COVID, the pandemic, has been such a toll on everybody, but especially on caregivers. I think it really underscores the importance of self-care, all together.
Yes.
But part of this comment was that with COVID and concerns around safety, that there's some reluctance to get professional assistance. So to have someone coming into your home or going to an adult day center. So just wondering if you have any thoughts or reflections on that, as sort of how people can best navigate. We're still in the pandemic.
It's such a difficult one, and there's so many people are hesitant. Totally understandable and realistic. I think one thing is that telehealth and things over the phone have become a lot more popular and a lot more available. So I think if someone is very hesitant about letting other people in their home, there's definitely a lot that can be helped through online services and even telemedicine. So doctor's visits can be over telemedicine, psychology or therapy could be over telemedicine, and even physical therapy has been doing more telemed. At the same time, I think most people in healthcare have been vaccinated, and I think, at least for Jefferson, I think it's October, I don't know, at some point it's required to be vaccinated. So I think, that hopefully will take a little bit of the worry. But yeah, it's difficult.
Yeah, there's not an easy answer to it, and there's not a solution to it. But I think it's important just to name, and yes, for you, any of you on the call who have been caregivers over the past 18 months, we recognize how difficult of a role that is. And again, there's not an easy solution to that, but know that there are others who are going through similar things, and to the amount that realizing you're not alone in that role can help. I would just also mention, I know there are some, in addition to telemedicine, there are some virtual support groups. Alzheimer's Association, for example, I know they're doing a lot of their groups virtually. So there could be some options there for additional support. Another question, and you talked about this a little bit, Emma, with regards to sort of the legal planning piece and for people who are unmarried, but any other considerations specifically for LGBT caregivers, or any specific advice for LGBT caregivers?
I think it's important to, or I'd hope that people feel comfortable early on discussing with providers or agencies who are involved what the relationship is between you and the person you're taking care of, so that it's clear, because physicians or other providers may, assume that you're either not related, and therefore you may not be the person legally able to make the decisions, just so that I just hope people feel that there is a place to discuss that, and that it's important for everyone to know who is involved in the caregiving.
Yeah, that's a good point. And I think that too goes to some of that the planning discussions, knowing that there are some people who may have LGBT folks who have multiple people providing different types of care, that you might have one person who's helping you with transportation, one person who's coming to help you with your meds. And so making sure that those different caregivers are communicating with each other, obviously with the care recipient, with the healthcare team, and really important to, as you said before, kind of having that team, which we know in the LGBT community isn't always going to be biological family. That we have families of choice, and we have these caregiving networks and friends and neighbors and people from community organizations and faith organizations, all of whom are helping in there. The other question I wanted to make sure we get to before we wrap up. So you mentioned at the beginning, Sometimes caregiving is for chronic conditions. Sometimes it might be shorter term, like helping someone recover from a surgery or an accident. Any kind of specific advice for those people in those shorter term caregiving roles, especially where maybe it's unexpected, but maybe less either intermittent or time limited?
Yeah, that's a good question. Do I have any specific advice? I think one thing that's from my point of view is that a lot of times when people leave the hospital or leave the rehab facility and then come home, it's easy for things to get kind of lost in translation. So if medications have been changed in the hospital, or there's new antibiotics or medicines that people need to take for just a short period of time, but then need to be stopped at a certain time, those stop dates or the changes in medicine can get kind of confusing, or can get missed or not clearly written down. And so if you're a caretaker of someone who just left a rehab or hospital, I think it would be really helpful to have that medication list or have it up to date, and also to feel free to reach out to the doctor or nurse if there's home care services coming to the house too, to make sure that medicines are the way they should be, basically, because that can easily get confused and be unclear.
Right. Thank you.
Yeah, I'm trying to think of more practical things too. I would say also feeling free, or I don't want people to feel hesitant about reaching out to the doctor or the nurse who has been coming to the house if anything changes. If right after a hospital or right after surgery, people are more likely to get new diseases or get maybe complications from what happened that wasn't clear before they went home. And so if anything big changes, it's important to let someone know.
Right. And I think one thing we've talked about in past programs, especially around advanced care planning, some of these other topics, it's so important to kind of make plans before you're in a moment of crisis.
Yeah.
And so I think that too, especially if you're talking about an unexpected health issue or an accident or something else that's going to kind of thrust someone suddenly into a caregiving role, as much as folks can have the conversations now with the people in their lives, either who would be caring for them or receiving care from them, some of that planning is so important. Yeah. I did put a couple additional links in the chat just for some other local organizations who we've worked with before, including PCA, the Philadelphia Corporation for Aging, their Caregiver Support program, the Alzheimer's Association, which Dr. Emma had mentioned, and I know they are doing a lot of virtual support groups these days. Lutheran Settlement House, another partner organization we've done some work with. They do a caregiver support program that really helps for caregivers to manage some of these stresses and navigate systems of care. So I know we're a little past our time. Thank you, Dr. Emma, for sticking around to answer these questions.
Yeah.
Thank you to everyone watching today. Hopefully you gained some resources and at least some sentiment of knowing other folks in our community who are going through similar things that you are, and practice self-care. No, don't be afraid to reach out for support and to tap into these resources that are out there. Dr. Emma, I'll leave it to you for any closing words.
Thanks for having me. I had fun. This is important. It's we've talked a lot about the stress and the burden, but I think it can also be something very meaningful and important and bring a lot of joy as well.
Absolutely.
Yeah.
Well, thank you so much, Dr. Emma. Thank you to everyone who watched today. And we look forward to seeing you all again at future Doctors In programs. So thanks so much, everybody.